Hello, everyone. Good afternoon. How are you doing today? Isn't it interesting that we find ourselves together on World Stroke Day? So I want to just start off by saying that I'm honored to be with all of you survivors on this special day. And I hope that you've taken some time for yourself to think about your journey and where you've been and where you're at right now. And I hope that this time together in our stroke recovery group has helped you to feel like you understand better where it is you are going to be going in the future. It kind of gets back to rule number one, which is the making of our map, right? That we have to know exactly where it is we're at now in order to know where it is we're going to be going in the future. So again, not so much a happy holiday. I think days like this are just good occasions to keep in mind that you are a survivor and that you are on a recovery journey that we want you to embrace. So hopefully you all can hear me now and see my slides. I'm just waiting on Carrie to give me the thumbs up, and then we're going to get started. Hopefully you guys had a chance to do some nice things today for yourself. Okay, so welcome back. We're going to talk about rule number 6 tonight. And we're going to talk about rule number 7, but before we get started on a new rule, we always like to recap what we did the previous week to make sure that the most important learning points were really driven home for everybody. So in session 6, we talked about rule number 6. This is increase your emotional resilience. And what we talked about here is the importance of keeping a positive and motivated attitude. And the reason it's so important is because it really makes a difference in your recovery. So in session 6, I hope you took my message that your stroke recovery is not just about healing your brain, that it's about healing yourself as well. And that identifying and treating common mood symptoms like post-stroke depression must be a priority. Up to 50% of you who've had a stroke that are listening to me right now, according to the research, have in the past, have now, or will develop post-stroke depression. And that's a big deal. That's a big number. So we want you to focus on what is within your control, practice positive coping every day. And we talked about the 7 ways to increase your emotional resilience. So let's go through a couple of those ideas just a little bit more. We talked about the idea that a stroke recovery is an emotional journey that happens in stages. It's not something that is the same for everyone. It's very individualistic, and you don't pass through it, in alphabetical or numerical order. It's something that you might go back and forth on. There's no wrong way to emotionally recover from a stroke, as long as you keep moving in some direction, okay? And more often than not, you're going in a more positive direction. So for many people, it starts off with a sense of unbelievability, shock, numbness, kind of hard. It's psychologically hard to wrap your head around in a short amount of time what has just happened to you. A lot of people, just in an act of psychological defense, have a time of being in denial, not really being able to figure out the implications of the stroke. And very often people go through an anger phase, a bargaining phase. Many people, as we know, get depressed. And those are kind of the more difficult growing times of an emotional recovery from stroke. And eventually, and slowly for most people, we eventually get to the point of acceptance. And we talked a lot about that last time, that it doesn't mean giving up, right? And that there's a certain way that you are when you are in a state of acceptance in your body, which is much more supportive to brain healing, kind of a sense of calm, a grounded feeling, as opposed to feelings of resentment, which is really associated with a lot of muscle tension, a lot of adrenaline and cortisol running through your veins that interferes with recovery. We then talked about how at the end, no matter when that is, at some point, what most people do who have really gone through the process of healing and acceptance is they find some kind of meaning or value in the experience of stroke. And they often use their own pain and their own journey to help other people, to make other people's experience a little bit less traumatic or stressful than maybe yours was. And we talked about those 7 ways to increase your emotional resilience for a better recovery. We talked about developing emotional awareness. This is where the feelings wheel came in. I hope some of you printed that off and have it somewhere visible so you can kind of check in with yourself, especially if you're feeling overwhelmed at any time. It's really helpful to look on there and just get more clear with yourself about what exact emotion you're feeling. We also talked about, once you know what you're feeling, the importance of sharing it with a trusted person, not just keeping it all inside yourself. Number 2, we talked about viewing your recovery as a challenge that you can manage, right? This is kind of the cognitive behavioral side of stroke recovery, which is really important. How do you think about your stroke? What is the story that you have told yourself in your head about your stroke? If your story goes something like, I'm to blame for what happened to me, or I don't have anything to contribute now, or my life, is negative now. They're important things to become aware of. And a lot of times people aren't even aware of how they label things. It's kind of like one of these pre-conscious psychological things that we do. And you have to kind of slow down and pay attention to your thoughts and really figure out, is that voice inside my head a friend or a foe? And that's really important to make that self-talk more kind. Number 3, we talked about how to choose to respond to stressful things with action, how to figure out what's within your control and what's not, and really being able to work on letting it go and accepting when something is just not within your control. And a good example of that for the stroke community, I think, is wanting other people to get it, wanting other people to understand what it is you go through. After you explain it in a respectful way, if there's someone in your life who can't see how hard you struggle and they really don't get that inner experience of stroke, you really have very little control over that. And so I don't want to know that things like that are weighing your recovery down. We then talked about choosing positive coping over negative coping. Coping is happening to us every minute of every day, or else we wouldn't be here. And oftentimes we choose negative coping because in that moment, we think it's going to be easier. And typically negative coping involves avoidance. We just shove it aside or push it down. But ultimately, it bites us in the butt. And we really want to understand what is positive coping all about. And a lot of it had to do with assertive communication, right? How do we let people know when our boundaries have been crossed and what our needs are? And number 5, we gave you guys a gratitude journal. I hope that some of you have been using that. That's a science-based way to increase your emotional strength. Number 6 is seeking support through therapy or medicine if you need it. I bet a lot of you who were with us last time were pretty amazed to hear about that data with antidepressants, right? We talked about how Prozac has been shown to not only improve depressive symptoms after stroke, but also help people get mobility and strength back in an arm, a hand. I think that's pretty amazing. And number 7 is that giving back to others who are walking in your same shoes. So that's a lot. It's not something you're going to do after one session with me. That's kind of your whole recovery kind of mapped out right there. But again, I'm such a big believer in having the map. I want you to return to this list over and over and see at any point where it is that you can make an improvement. Okay, so again, remember, viewing your recovery as a challenge that you can manage is a really, really important piece of keeping a positive attitude. If deep down you feel that you're not going to handle this and you're not going to be able to cope with it, then that makes the slope of your everyday journey a lot steeper. Okay, it makes that rock a lot heavier. So let's transition into support those who support you. This is rule number 7. I love this one. And the way we're going to start off talking about this is reminding you that a stroke did not just happen to you. It also happened in its own unique way to the people who love you and the people that care about you. And that is so important because those of you who are with me now, I know there's many of you who are watching with your person, your support person, your caregiver, or you're going to go after and talk to them about it. And what I'm really asking you to do in our time together today is I want you to put yourself in your loved one's shoes, right? Anyone that helps you, that takes care of you, that supports you in this journey, we consider these people to be your care partners. Okay, so put those New Balance shoes on today and think about this stroke journey from their perspective. Okay, just like you, their lives were changed in a very, very short amount of time. And we expect that many of these people are living with post-traumatic stroke stress and working very hard to adjust. Okay, so we have to keep in mind they really have their own recovery journey. The more support that someone provides you with, the more likely they are to ignore their own physical and mental health and well-being. So you kind of have to think about, if you have a caregiver that helps you out, in smaller ways, they aren't at risk for some of the things we know that can hurt people who are caregivers for folks with a lot of needs, kind of 24/7 caregivers. Caregivers often have responsibilities that change, and they can change at any point at different points throughout the recovery. So at some point as a caregiver, you can be a coach. At some point as a caregiver, you can be a chef. At some points, you are a physical therapist. At some point, you are a secretary. At some point, you are a lifter. I mean, it really just goes on and on and on. Let me just make sure here for a second. Can you guys see my slides as I'm changing them? Are you with me right now on the caregivers often have responsibility slides? I'm going to ask Carrie. Hopefully she'll send me a text. Okay. Most caregivers will tell you that their care is a labor of love. There was a study that came out about 11 years ago that asked caregivers what they thought the benefits of the caregiving experience was. And over 90% of them reported that caregiving enabled them to appreciate life more. But we can't make the mistake of not realizing that this is very hard work physically, hard work emotionally, hard work financially for some people. It really cuts across all ways of giving. Look at this statistic here. 98% of stroke caregivers report one or more stressful problems. 98%. And so I wanted to share that research with you, because if you're a caregiver and you're listening to me and you sometimes worry if you're not handling this well, if you have too much stress, it's very, very common. That's kind of a characteristic of being a caregiver, is you're stressed out. You're like this overwhelmed human that we have here. So what are the most common problems that caregivers talk about? Fatigue is a very big one, feeling very, very tired. Restricted social life, not being able to accept invitations like you might have done before, especially spontaneous invitations. Relationship difficulties, we're going to get into this one. Balancing responsibilities between maybe being a worker, maybe being a mother, being a caregiver, being a friend, being a person, just trying to do it all. Not being trained in the new skills that you need. I think of all the list I have here, this is the one that burns my butt the most, because that is so unnecessary. We should really not be at that point in medicine today where people are leaving rehab not knowing exactly what it is they're supposed to do for their loved one. Now, I understand, of course, there's some training. I've been a part of rehabs, and I know that there's help with transfers. There can be help if you have to do a PEG tube. There can be help with, bowel programs. But what I'm really talking about here is more of the psychological skills of coping and adapting and managing your own grief within an instant. Not only are you the person who's had the stroke going through all of these identity shifts, you go from a person to a patient, right? Well, caregivers have the same experience too, and there's no time for them to process things and to have their grief as well. Uncertainty about recovery is really tough on caregivers, kind of not knowing what the future holds. A lack of support. Caregivers will tell you, this is across caregivers for stroke folks, for dementia, for spinal cord injuries. They will tell you that people fade. unfortunately. There can sometimes, be some lip service about people that want to help you and support you, but it doesn't always come through. And that is a stereotype. Some of you might have amazing support systems, and I'm so happy for you if that's you, but just kind of on the whole, I think many caregivers would tell you that they wish other people helped more. And of course, the financial barriers of recovering from a stroke are huge. You all know this better than me, the strain on you, if you know darn well your person would benefit from more speech therapy, more physical therapy, but they've run out of insurance sessions, right? Feeling like, am I going to make the mortgage payment, or am I going to hire a speech therapist out of pocket to come to the house? So these are big responsibilities that weigh on our caregivers. On the road to recovery, stroke caregivers report that the hospitalization period and the transition home, that first 4 to 6 weeks post-discharge, is the most difficult during the first 2 years. So again, this is an average or a mean, maybe not the truth for all of you, but this is a really good time period if you're well on your way into your recovery, where you might want to check in with your caregiver or your loved one or your parent or friend, and maybe ask them, what was that like for you when we were in the hospital? What was it like for you when we came home? All too often, I think we don't give people the tools to have these conversations, and they don't happen. These are sometimes very difficult conversations, but as you know, the theme we have here in this virtual stroke recovery group is that talking about things is better. Open communication is healing. Stuffing things away and avoiding the things that are hard for us is not advised. It backfires and it boomerangs and gets us in the end. Part of the issue we have with caregiving is the sudden onset of stroke, okay? If we talk to caregivers of different medical issues that were slower to come on and that there was a slower progression, what we find is that the trauma that goes along with their experience is still there. Of course, we would never invalidate someone's trauma, but it's not as high as for people who have a loved one who got hit by a car, had a stroke, had an aneurysm. It's something about that suddenness that we know is hard for caregivers because, again, in an instant, they are thrown into a new role with little or no preparation. And so what happens is, being human as we are, we oftentimes then experience this as being ill-prepared or questioning our own ability to do the job. Now, some people are just not born of the cloth of a caregiver, right? A caregiver is definitely a special person who has, high empathy, pretty good physical energy to keep up with it, and can really connect with the pain of another person and be in service to them. I have met people that were literally born to do this and embrace it. And I have met other people just as valid who it is not that way for them. It is not a match for them. They're extremely uncomfortable with the intimacy of caregiving, and it's very, very, very stressful to them in their own unique way. So we have to, be asking people, to the degree of their comfort level, and that's just without any support. So as a psychologist, what seems obvious to me is that why aren't we maybe polling caregivers in the rehab setting and asking them to tell us the truth about their comfort level and what are they naturally good at and what are they not? And then how can we build a caregiver support program around that person? So caregiving is emotionally challenging. This is almost a universal fact. Even if it is an absolute labor of love, it is hard. There's just no way around that. It's not hard maybe all the time, but there are moments of real despair, grief, sadness, and loss for a lot of people. So up to 60% of family caregivers report high levels of emotional distress to meet criteria for depression, anxiety, and traumatic stress. And what's unfortunate is that once people have these symptoms, unfortunately, research suggests that they remain chronic. So that leads me to feel like we are not helping caregivers talk about their recovery journey enough, but more likely it's that we're not listening well enough as doctors and medical communities, and we don't have enough resources to provide people when they tell us at a rehab follow-up that they're struggling, or we're not taking time within our clinical interviews to ask the right questions to make people feel that there could be help if they asked for it. Caregivers cope better with physical impairments and have a harder time with the mood and personality changes and the cognitive impairments. And I definitely hear that from my patients. People who say, you know, I can deal with repeating questions all day long, but when it feels to me like I'm talking to another person, you know, that really makes it hard on me. It's really important to note that the higher the stroke survivor's emotional distress, the higher the caregiver emotional distress. So they literally go hand in hand. So stroke survivor doing good, having a good day, you're going to find that the caregiver's feeling good, having a good day. When stroke survivors feel upset and traumatized and stressed, the caregiver feels it too. And so I just want to share that. And none of this is meant to make anyone feel, you know, overly sad or worried about their caregiver. It's really just to help you develop more empathy and to take their perspective, right? And so for some people, this could be a motivation to want to treat their own post-stroke depression or post-stroke anxiety, because it's not just about you, right? It's maybe about your wife too, or maybe it's about your mom too. And so for some people, they are more oriented towards others, and they might be more motivated to do something about their own mental health symptoms if they know that it's also maybe affecting their caregiver. Your caregiver's psychological health really makes a difference in your recovery. So let's just say, you know, that's not something that motivates you to think that your caregiver, you know, might be sad if you're sad. Well, how about this? If your caregiver's stress is high, the science tells us that it reduces their ability to provide high quality care to you and negatively impacts your recovery, including worsened physical recovery, more medical issues, and more cognitive decline. So probably what is driving this effect, I'm going to say, is probably exhaustion and very, very high financial stress and very high emotional stress, right? Kind of all the ways that caregiving can go more difficult is then when it's really high and it's in multiple domains. If you don't have the money to get people additional therapy, if your person is, you know, has global aphasia and is not allowed, pardon me, is not able to speak, if there's a significant physical recovery, you know, I think of so many of you with Hoyer lifts and having to do, take on a lot of the weight of someone during a transfer. These things are really hard on caregivers' bodies. I mean, a lot of caregivers, you know, have a bulging disc or, you know, a pinched nerve in their neck because of all the physical strain that can come along with caregiving. So if you go through some of that stuff, then you're obviously less able to provide physical care. You know, you might be so exhausted to the point where you don't notice if there's a new medical issue, and you might not engage or interact with your person as much as you might if you weren't bone exhausted and, you know, totally spread very thin. There's 3 common challenges for caregivers, and I wanted to go through these with everybody. And again, what I'm really hoping that you caregivers who are listening to me pick up on in this lecture today is that all of this stuff is very normal. I think that the minute we start to feel like there's something wrong with us, or perhaps we, you know, are developing some kind of a problem, then we get into judging ourselves, and then we've got an extra problem now, right? But this is the road of caregiving, and the problem is really that we just don't talk about it enough. It's not having any of these symptoms. These symptoms are so universal. What that tells me is that this is a human challenge. It's nothing to do with you as a person. So many caregivers I know, the best caregivers I know, question if they're doing a good enough job. And so a big part of what I want you to hear from me today is if you're here listening to me as part of this recovery group and you're a caregiver, I guarantee you that you are awesome. You care enough to be here. You care enough to get information. You care enough to apply my information. So I really want you to hear all of this in kind of a validating message. So the first most common challenge for caregivers is dealing with uncertainty. And we're going to go through a slide on each of these. Next one is difficulties managing big, anxious emotions. And number 3 is the being overwhelmed at managing a new life and a new role. So here we are with dealing with uncertainty. So uncertainty comes to us in the form of questions that feel very, very overwhelming. What does the future hold? Big, big, big questions. How much will my person recover? Practical things. How much are these hospital bills going to be? Will my person walk again? What is their speech going to be like? Will this person have another stroke? Probably the biggest question that caregivers ask themselves is, how am I going to do this? And again, I think that's why those first 2 weeks, when people get home from the hospital, everything is new. You haven't developed routines yet. You haven't figured out your shortcuts. You have no schedule. There's no structure. And again, we all this is just the truth, and our job as a society is to pay attention to the truth and to build resources and programs around people, right? There's no good reason that people should have to suffer like that 2 weeks, 4 weeks after they get home. That to me is a responsibility of a good society, is to provide for people during those weeks. Symptoms of high anxiety, including panic attacks or a symptom we call hypervigilance, are very common. And the closer you are to your person, the more likely it is that you could feel this way. So what is a hypervigilance symptom? Basically, it is always being on alert for another stroke, a fear of falling, and it can be so high that the caregiver can feel like they can't take their eyes off the person. And this is a big part of what leads to exhaustion in caregivers, is the lack of downtime, the feeling of being ever watchful, feeling like you can never let your guard down. Okay. And probably the reason that anxiety is so high, including panic attacks in caregivers, is because of that tension between hypervigilance and avoidance. And this is really what rule number 8 is all about, what we're going to talk about next week. We'll get into this in a lot more detail, but basically in any type of traumatic stress after a big stressor, what we're kind of left with, there's a spectrum, right? And so we're constantly hanging between the tensions between both ends of the spectrum, which is on one hand, the symptoms that make us feel like we can't get the stroke out of our head. We can't get certain images. We can't get the fears and the what ifs out of our head. But our human nature wants us to avoid and wants us to pretend things aren't that bad, or they didn't happen, or let's just not talk about it. I don't want to think about it. There's all sorts of tension psychologically that happens within us when we are living through this. This could be the stroke. This can be a car accident. This can be any major big life-threatening thing. We don't realize when we have a trauma how much physical and mental energy we put into avoidance, which is pushing it down, 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 down. But that's a lot of force. That's a lot of energy. And when we push something down hard enough, when it eventually pops up, it comes up with a lot of force. Okay. So imagine you're in the bathtub and you're pushing down a big red ball. Boy, you can push it under the surface for quite a long time and it doesn't seem like a ball is there at all. Well, after a little while, you take your eyes off it and all of a sudden it pops up. It doesn't exactly float up to the surface gently, kind of comes out of nowhere and can almost scare you with the splash that it leaves behind. So that's really how traumatic stress works within us. So I think a lot of times caregivers are just coping and in the moment and dealing and trying to stay within the box of this moment and this day. And not try to think too hard about the big picture, that when those thoughts come up sometimes, they can feel very big. And really the biggest way that they kind of explode out of us is with a panic attack. I just think this is so important. And it turns out it's the number 2 most common struggle that caregivers have, which is that instant new job, that instant new role, feeling like you have to navigate all your previous responsibilities that you came into this stroke experience with. And now all of a sudden providing care, monitoring, keeping your person safe, and not only keeping them where they're at now, but there's a lot of desire to get them better, right? We're so wanting people to make the best recovery possible. That's why we're caregivers, because we care about that person deeply. But my goodness, it's a lot to adapt to. And I just always go back to the fact that I truly think that we're failing caregivers. I think that we do a crap job of telling people what to do, telling people what to expect, not expecting them to do it all on their own, not giving people good answers about their person's brain injury, no matter what it is, not helping people really understand secondary stroke prevention, all the things basically that I've tried to incorporate into the stroke recovery guide and this stroke recovery group is all the things that I wish that people would be told in kind of a systematic way. Like imagine if in your rehab, there were, 10 classes that you were able to take that were basically like this group here, right? And your emotional journey was as best as it can be kind of laid out. The new responsibilities, you were able to just say like, what I'm a little bit worried about is such and such, but it's so piecemeal and it's so not enough. And we're really struggling to get people to transition well into the role of caregiver. Caregivers are notorious for doing this, sticking their head in the sand, ignoring their own health and adjustment to focus on your recovery. And it's kind of like the double-edged sword of being a really good caregiver is you provide excellent care to your person, but sometimes when it comes to your own journey, your own health, those things don't get attended to. There's a lot of good data to suggest simple things like caregivers don't get their teeth cleaned like they should. They miss out on vaccinations and flu shots. They, don't do any of their own therapy, right? They can become so focused on you and your recovery, and that is helpful, but also potentially puts them, down under a little bit. This is one thing I would love to do a much bigger program on this one day, but it's how stroke can impact marriage and personal relationships. Okay, so this is yet another thing. We see very little programming about this, but it's a real life problem that's happening to people all the time. 54% of families experience relationship problems after a stroke, and as many as 38% of couples experience overt conflict. Studies with couples specifically has found that couples can experience communication issues. The stroke survivor can feel overprotected or controlled. That is a very common thing. And again, difficulty adjusting to the new identities. For the stroke survivor, I think that is quite hard to all of a sudden be a patient, right? Even when we use the term stroke survivor with pride, I assume that the first time you hear that, it's a little bit of a pill to swallow. Research with couples suggests that differences between survivor and spouse perception of the survivor's physical and cognitive capabilities is often the cause of distress. So what do I mean by this? So this is a caregiver and the stroke survivor having two different opinions about how the stroke survivor is doing. So this is when the stroke survivor often thinks that, they don't need any more therapy, that their memory is just fine. And the stroke caregiver is feeling like, absolutely, you need more rehab. You need to do these exercises at home. I want you to, get those sheets out, and I want you to get back to doing those therapies at home. And the survivor feels like, I'm fine. There's nothing else wrong with me. And, we have to remember that differences of opinion between married couples happens all the time, happens pre-stroke. But I think there's just so much tension and there's so much traumatic stress going on with both the caregiver and the stroke survivor that it's very easy to have strained communication. And this also goes for personal relationships, parent and child, in either direction. Child has the stroke, parent has the stroke, brothers and sisters, best friends. We just focus so much on the physical recovery that I feel like we're really leaving some of the psychological problems behind. So when we ask people, and this is a very recent study, this just came out a few months ago, about relationship challenges, there were 6 common reports that came back, and I wanted to go through those with you again. I think this is a ripe opportunity to get normalized and to feel validated, like, oh, awesome, this isn't just us that's struggling through this. Like, this is the stroke relationship template. This is what people struggle with, okay? I took my husband's Steelers Cup. Do you guys see that today? Oh my God, I'm so sick of hearing about these Steelers. They're 6-0. They're 6-0. That's all I keep hearing. Okay, so let's go through the first one. So the most common challenge is impairments in the survivor's communication. So what do they mean by this? What they mean is when a person has aphasia or any kind of dysphagia or difficulty with communication, all the way up to something like locked-in syndrome. This is stressful. We want desperately to be understood, and we desperately want to understand. And so it's human nature when we can't do that easily and quickly on one side or the other. And so between two different human beings, it's very expected that either the person themselves is going to get frustrated or we can get frustrated on our end. And it's not a matter of impatience. That is literally your nature as a human being. When we don't understand, I mean, just pay attention to the next time you feel like someone's mumbling and you know you're not going to be able to get what they said. Just yesterday, there was some water running and my husband was probably yapping my ear off about the Steelers, but he said something and I was so annoyed within a heartbeat because he was talking to me when the water was on. And I'm like, I can't hear you if the water is on. And I basically went from like 0 to 60. I thought I was in a perfectly fine mood and I was like instantly peeved. And that's just me. That's just being a human being, right? As much as I know this stuff, we all just default to our human nature at the end of the day. Number 2 is impairments in survival, physical activity, physical function or mobility. So what they mean by this is just tensions around like the physical actions of getting in and out in a day, right? Up and down from the bed, toileting, dressing someone, just like the basic physical aspects of living with a significant stroke. That oftentimes is very hard for two people to figure out their groove and their rhythm and how much help does the person really need. And that's a tricky spot caregivers are in. You don't want to foster dependence, but you don't also want to leave your person hanging if they are struggling, right? And so that's just growing pains, figuring out what they need, what you can offer. It's tough. It's really tough. Number 3, we talked about this a moment ago, but is differences of opinion about the value or effectiveness of rehab. This is something that I definitely hear commonly from my patients. And it's typically the caregiver will pull me aside and say, I just want him to keep doing the exercises at home, but he feels like if we go to PT and he does his 40 minutes of PT, then he's good for the day, right? And I really want him to do them again twice during the day. And that can create tension because now we've got a power struggle, right? We've got two people who want to be the decision maker, and that's hard. That takes negotiation. At the end of the day, we can explain to someone why we think they would benefit from more rehab. We can show them presentations like this and hope that they would make a different decision for themselves. But until someone is declared incompetent, the way we operate in this society is that people at the end of the day can make their own decisions. And if someone doesn't want to do the things that maybe as a caregiver that you believe would get them better, then unfortunately, after try as you might, if the person then is limited in their long-term outcome, then unfortunately that's on them. Now, a lot of times I know caregivers feel like the person isn't making that decision totally rationally, that it's part of their impact from stroke that's making their thinking a little bit off about the value of the therapy. And I think that just comes down to communication. Again, another great reason to see a neuropsychologist, because sometimes if you take it out of the relationship dynamic and it's a doctor saying it, that can be different. People can hear that information differently. Number 4, again, adjusting to those new identities. Man, that is so hard. I wish that caregivers, just like stroke survivors, had, a group that they could go to and talk with people who are further in the journey than them and learn from them, not have to feel like they have to reinvent every single wheel. Number 5 surprised me a little bit. It's changes in household responsibilities and leadership. And what people were talking about here was things like taking out the garbage. Who does the bills? The person who had a stroke used to be the financial person. And now, unfortunately, even for the time being, they're not able to do that responsibility anymore. And now potentially it's on a wife or a husband to figure out, who's doing this and what am I supposed to do? And then further, it's the meaning that we put on household responsibilities, right? We still live with a lot of gender stereotypes, right? So, I mean, there's still this idea like the man takes out the trash, or, the woman does the cooking. And when we have to change up those roles, people aren't always comfortable, and it's an adjustment. And number 6 is a perceived lack of support from other family members and friends. So this typically comes up with people's children or people's spouses, people's siblings. So just not feeling like your village is really coming together to give as much support as you need. We definitely see kind of a peak of offers of support early on, and then over time, for most people, they can kind of trail off. And, this can be hard if maybe you're in a blended marriage and your wife had a stroke and she had a couple of her own kids, and your kids, who are her stepkids, are maybe really stepping up and giving you guys a lot of good support, and her own kids are kind of ghosting on you. Those are the kind of things that stress people out in close relationships. Is you don't want to say anything, right? You don't want to say anything bad about her kids, but it might burn you up that they're not more present. And so all of this is the human kind of relationship, messiness that happens when there's an unexpected stressor. So what I want you to do with all this information is to make time for conversations about how your relationships have been impacted by this stroke. And the most important thing is to remember, you may have many skills and talents in this life, but chances are being a mind reader is not one of those things. And this is how we get ourselves into trouble a lot, is we think we know someone's intentions. We think we know why people do the things they do. We think we know what they're thinking and feeling. And the truth is we really don't. We really, really don't. So there's a set of descriptions in psychology called cognitive distortions. And this is really relevant here, which is that when someone acts in a certain way, we think that we can ascribe certain feelings or intentions to that behavior, right? And so a classic example of this may be, a woman in front of you on your way into a church service doesn't hold the door for you, right? And you're annoyed and offended, and immediately you think, oh, I've met her before. Oh yeah, we were on that committee together, and I voted against her club that she wanted to start. And oh yeah, I mean, she definitely did that to me on purpose. We take things personal, but maybe the truth is that woman just got diagnosed with cancer and she's totally in her own mind. So very often we take things personal when they're really not about us. And we interpret people's motivations according to our own mood. That's a really interesting thing that you can start to pay attention to about yourself as you go through life, which is how you feel about something really dictates the type of lens that you put on your view, right? This was never more apparent to me than when we were looking at houses a couple years ago. And it was really interesting. The moment we walked into the house, you just kind of have a general sense if you like a house or not, right? So if we decided we didn't like the house, every little thing that we pointed out was negative, and it was like, oh, that's never going to work. And it was just like a blanket lens on the home, negative, right? If we thought we liked it, it was like even a negative thing. I'd be like, well, we could just change it. I mean, that's no big deal. Walls can come down. Paint can be changed, no problem, right? So that's kind of getting back to this idea of why is a positive attitude important in recovery? Because it changes your lens, and you're going to see things as more as they are with less distortions, and perhaps even kind of see the glass as half full, depending on how you feel and what your attitude is. So how is it that you, the stroke survivor, the person who had the stroke, can help your caregiver, the people that are in your world of helpfulness? Well, anyone who's provided you with support as you recover is worthy of your recognition and appreciation. Now, this can go from your spouse who takes care of you, a parent who takes care of you, to a good doctor, a therapist, an aide, friends, family. In my experience, a lot of people get a lot of emotional support from their therapist, their physical therapist, their occupational therapist, their speech therapist. And I think it's because they have that beautiful combination of skill and expertise and compassion. You develop a relationship with them. So when they say something, you pay attention. When they compliment you, you believe them, right? If they give you constructive criticism, you're not that hurt by it because you know that they have your best intention at heart, right? So let's just say you take a few minutes. Let's identify who are the people that are within your sphere of influence that have contributed positively to your recovery, okay? Once you have those people in mind, there's many ways that you can show your gratitude for all their gifts of support, both big and small. So let's spend a couple minutes talking about specifically what could you do? Well, there's really three ways that we can approach this: the power of words, the power of touch, and the power of deed. So let's go through those. Power of words. If you can use your words, you can either speak them or write them, or let someone know how their support has helped you. If you're not able to write, you can try to speak as very best you can to someone else and to have them write, or let them know, please, give someone my best regards and my appreciation. What you want to think about is being very specific and being very genuine. You don't have to say anything except what's in your heart, okay? Think how you would have felt if not for their support, and let them know how much they've meant to you. If you're not the card writing type, you can go to a store and get a bought card that captures your feelings. Or look at this. We jumped in here to try to make sure this was an easy recommendation for you to follow. So if you have a copy of the Stroke Recovery Guide, the hard copy, we have included appreciation thank you cards in there. This is on page 75. So the first one is knowing that you care is my best medicine. And on the back, you get a chance to write something a little more personal. My brain and I could not have done this without you. Thank you for making a difference in my recovery. And thank you, your love and support is appreciated. So just a little gesture of taking your time to reflect and to be genuinely thankful for what someone has done for you in your recovery. Now let's talk about touch. Appropriate touch releases those feel-good chemicals that we want to keep talking about, like oxytocin, that can help strengthen trust and reduce the brain-hurting chemicals of adrenaline and cortisol, right? That definitely has come up a lot in our time together. We want the chemicals, the neurotransmitters that are in our body and in our brain to be the really positive, growth-inducing ones and not the negative, growth-inhibiting ones. Again, take a moment to connect physically in a way that is respectful for the type of relationship you have with the person, right? You're not gonna hug your mom in the same way, you might hug, your doctor. You're not gonna, go over and give a smooch to your husband in the same way you might your physical therapist, right? So you gotta figure out what's appropriate for the relationship. But typically a hug or, just like a hand-on-hand gesture, like, squeezing someone's hand, that's like the universal gesture of gratitude, right? Everybody pretty much is comfortable with that. And the next one is deed. And so what does this mean? This means this is where gifts come in, right? Anything that is thoughtful, that you feel like the person would like. Themes that focus on self-care or pampering are always appreciated. Just think about what that person might like and find something affordable to give them. Definitely does not have to be fancy schmancy. It can literally be their favorite candy. It can be, my goodness, a $5 Starbucks gift card, right? It can be the smallest of things, okay? So as we start to kind of wrap up with our this part of our lecture, I just want us to all kind of talk about how we need to do better for our stroke caregivers. So when psychological therapies are offered after stroke and actually delivered, what we see today is that they're either focused on the stroke survivor or the stroke caregiver, okay, with no real inclusion of the relationship. So if you've been lucky enough to be involved with a stroke support group, typically it's for the survivor or it's for the caregiver. And absolutely these things have value. There's nobody like your tribe to feed back to you what you're doing right, where you may be wasting your energy, you know, how to cheer you on. But there's also something to be said about having both people in some kind of a group or in some kind of a therapy to get at those relationships, because we are extremely social creatures and we are all in relationship, even to ourselves, right? So in 2017, the American Heart Association did recommend that psychological interventions include both patient and caregiver. But, you know, I ask you all to tell me if you experienced any type of caregiver survivor support group. So not just, you know, husband and wife, wife and wife, husband and husband, but, you know, mother and son, brother and sister, these kind of things. It is my belief, and I am sure I'm preaching to the choir here, that psychological interventions for caregivers must be integrated into stroke rehab. We really need to care more about caregiver quality of life, just like we do patient quality of life, and well-being. And I think the way we could really do this is skills development, practical, specific training, education. Okay, you know, what was this specific stroke all about? How has it affected the person backward and forward? You know, what can you expect? What are the specific things you can do to help? And supportive problem solving. So what that might look like is, you know, something like remember we talked about this a few times ago, this idea of a neuro navigator, a brain navigator. Imagine if there was someone after you got out of rehab that you could call on and have a very quick answer if you had a specific problem. Okay, so right now, this is a real life example. I have a patient who had an aneurysm a couple weeks ago, and over the weekend, he started to complain about an intense burning in his throat that was keeping him from eating. And his wife made a bunch of calls. It wasn't quite at the level where she felt like she wanted to risk going back in the hospital and COVID, and he has a lot of anxiety about the ambulance and all this. So she wound up reaching out to me, and we had a couple conversations. And you know, I tried my best to support and guide, but I am not a physician. I am not a medical provider. I can't legally provide specific medical information. And it was a struggle to kind of get her to Monday when the doctor would be able to call her back. And it turns out within just even a couple of days, he lost pretty significant amount of weight. And tomorrow he's scheduled to go get a peg tube because they can't figure out quick enough what's wrong with his swallowing. He says it's like a burning sensation. So, you know, having a helpline, a problem solving line with, you know, people who can make medical decisions would be a wonderful advance. So here are some tips for caregivers as we round out our time. What are some ways that you can support your loved one? And I wanted to include this because, again, if you are a caregiver listening to me today, you fall in the awesome category because you care enough to try to learn and implement, you know, best practices for your person. So in my experience, the people who are caregivers that are doing the best job try to do these next few things I'm going to talk to you about. So the first one, and it'll be interesting to me how many of you tell me like, oh, I do that. Because this is really a common thread that I see in the people that I think are really, really doing a good job as caregivers. First one, very important one, is to be an excellent record keeper. Right? How many barriers do we see to care because the doctor didn't get the report, doctor didn't read the report, right? So this is things like hospital records, MRIs, changes in medications. So what I recommend is getting a binder and putting all your stuff in there. You got tabs, you know, hospital stay, first MRI, second MRI, and bring it to all the medical appointments because you have to make the most of those limited times that you have with these medical experts to get your questions answered. And we don't want anyone punting you because they don't know at that exact moment what the milligrams of the baclofen were back in November, right? It's like we want to have all information right there in front of us. You are already doing number 2, which is educating yourself about your person's stroke. This is where we get back to rule number 1, which is the idea about getting the original neuroimaging, sending it to me. I'm more than happy to help you interpret that, and educating yourself about what part of the brain, what type of stroke, and what those parts of the brain do. As you know, my opinion is all too often people hear about how it physically manifests, and a lot of times there's things happening behind the scenes that you wouldn't typically be told when you go to your traditional neurologist. The next one is you're going to have to get real comfortable being an advocate. Okay. If you're someone who's a bit of a wallflower by nature, or you've not had a reason to speak up, well, there's nothing like being a caregiver to put you in that role. So getting comfortable saying, I'm sorry, you just used a word I don't understand, or can you slow down? Or, okay, can you tell me how that relates to what this other doctor told me? Medicine today requires you to be an active participant. If you are a passive participant, recovery of the highest caliber will pass you and your loved one by. You have to be integrally involved. Don't let anyone tell you that that's not your role. Okay. It's a fine line. It's a dance in how we encourage and support our loved ones to do the hard work of therapy. And I know that all of you try your best. Okay. What the research tells us is, trying to have the most supportive, loving tone, enthusiastic attitude when we approach someone. But I thought this was an interesting tip, is just putting reminders around the house for helping people do things on their own if they're capable of doing that. Okay. Or, using technology, like giving someone an alarm on their phone, when they might be done with the exercises. Just little things like that around the house can reduce caregiver exhaustion, because you're not kind of constantly running behind the person, and can encourage independence in your person. Now, of course, this is a general recommendation and it's not going to work for all of you, and I'm sorry for that. But in any way that you can try to provide reminders, visual cues around the house. Some people can even do this with pictures that, if your person is in bed and they're not able to independently move, making sure, there's visual things that they can see, like, thumbs up or happy faces, or a picture of you kind of smiling, things that aren't necessarily verbal, but that anyone would be able to look at and they would interpret it as a gesture of support. The next one is helping your loved one return to their hobbies or leisure activities in any way that works for them now. I remember I talked with one of you through Zoom couple months ago, and you're going to know exactly who you are when I give this example, but I'm not going to say your name just for privacy. But we had talked about how someone on here's a very important person had liked car racing before their pretty significant stroke. And so we were putting our heads together to figure out, well, okay, obviously the person can't, race a car, or, and so we talked about like just going on YouTube and trying to find, top 10 car races, or a perspective on a video that is kind of like as if you were in the driver's seat, right? So all the way from passively bringing activities back into the person's life to encouraging them. We have a wonderful program here in North Carolina called Inspiration Golf, and I love this guy and his program. And basically he takes people who are either golfers or want to become golfers and works with whatever physical or sensory limitation they might have, right? And so sometimes it just really takes support and a push to help someone get back into it when they can't do it the way they did it before. And we've talked about that in terms of cognitive stimulation. Your brain networks are built on your hobbies and your interests, right? The things you're passionate about. Whole parts of your brain are organized around golf, race cars, baking, sewing, whatever it is. And so whatever it takes to reactivate that part of that person's brain is really a huge job in rehab. So whatever it is that you can do, like I said, bring someone something that they can touch and feel, put something within their visual view, find an adaptation recreation program in your area and call them up and see what it would take to maybe get your person in there. Just try to be an active advocate for them to get back to the things that they used to like. Ask if you can assist with communication. This is a really, really important one. when your person might have speech problems. I get asked this question a lot. If you see them struggling with words, is it better to just jump in and answer, or should they figure it out themselves? And my answer is not totally clear, but hopefully it will give you some guidance. I have a couple rules of thumb. My rules of thumb pertain to two scenarios. One is when things are good, and one is when things are not good. So what do I mean by good? By good, I mean well-fed, not tired, maybe earlier in the day, focused. If the person comes, this is probably more for people with mild aphasia. But this is a symptom that really bugs people, and it's common. So if your loved one, it's 10 o'clock, you just went through meds and breakfast and they're struggling, what I would do in that scenario is be patient and pause, don't jump in, and just simply say after a few seconds, perhaps, can I help you with that? Ask permission, okay? If it is 9 o'clock at night and your person is exhausted and they're clearly frustrated, then I'm less inclined to ask permission, and I'm more inclined to just kind of gently provide the word, right? You can certainly at the end of the day say to someone like, can I help you? But what we typically find is that that's when people can kind of snap back, and really people just want the solution at that point, right? During the day when there's energy, we can kind of make it a therapeutic activity and help the person search. So, can I help you with that? Okay, they say yes. You can say, can I give you the first letter? Can I give you the first sound? What if I spelled out half the word, right? They may say, just give me the word, and just give them the word, right? But what would be ideal for brain recovery is if you could engage in a little bit of a push-pull with the person to try to help their brain do the hard work of finding the word. And the last one is really, really important. This is making sure you are being sensitive to your loved one's experience in social settings, right? Social exchanges like dinner, group conversation. This is a very common complaint of the whole brain health community, not just stroke survivors. When I was doing my undergraduate honors thesis, I got a focus group together of people who had just been diagnosed with very mild Alzheimer's disease. And my research project was very simple. I just asked them, what bothers you the most? And what do you want your doctors to know about your experience? And it was really pretty remarkable that all of them said getting left behind in conversation was the most hurtful thing that had just started to happen to them. That they needed a little more time to process. Their ability to kind of take in, more than two people talking was starting to feel, hard. And that what people did is they either just talked over them, or most commonly just kind of ignored them, and they just kind of dropped out of the conversation. And it's such a human thing to be seen and to be encouraged to participate in social interactions, that it's really, really quite painful for people when they feel like they're being ignored. This gets back to some of this research. I think I said this last time, where we talked about the effects of different type of abuse on children, and that physical abuse actually is much less impactful than neglect. Neglect meaning when children are ignored, when people don't seem to care, when they're treated like they're invisible, that actually has much deeper psychological scars than if someone is beat. And the idea is, at least when you're beat, you're a real object, right? You're there, you bother someone, at least you exist. And when we are neglected, it's as if we are not even there. We're a non-person. And that's really a very extremely painful thing for us to go through. Helping your loved one have moments of joy and laughter, even if it's just for a moment, is the prize. That's really important. So many of you care so deeply about your person, and really you just want them to be okay. You just want them to be happy. And in the big picture, that's a lot goes into that. What makes a person happy, what makes someone feel good about themselves and their lives and where they're headed. That's a really huge task. And so if we just kind of tune that into smaller pieces and just kind of focus on the here and now, and do the cute, funny things we know that might give someone a chuckle. I mean, there's a huge release of those positive chemicals in that person's brain, and there you are as a caregiver pushing their recovery along. Also, we want people to know that it's okay to grieve and be sad too. We don't want people to just feel like we always have to process, you know, the negative and the heavy and the deep. We want to, you know, let people know that they can experience moments of lightness, but if they do want to get serious and talk about the deep stuff, that, you know, we're right here to take that serious. And the last one is when the time is right, encouraging that community outreach. If you know, are focused on your person's emotional recovery and you've seen them go through all those phases we talked about, you know, there's going to come a point where they have reached that point of acceptance. And that's a great time to jump in and yet again, change up your caregiver responsibilities and be able to say, hey, you know, what if we called the senior center and maybe they could have us come talk about, you know, signs of stroke, or maybe we could call the rehab unit and see if they have a peer-to-peer support program. These things are all, of course, difficult with COVID, but you get my point, right? I did want to tell you about the Family Warm Line that's offered by the American Heart and Stroke Association. This connects stroke survivors and their families with the team member that can provide support and information from someone who's been there. So remember before I was kind of telling you about my version of, you know, how a rehab should do things. And this was really the closest I came to finding something that fit that bill, but it doesn't really get publicized nearly enough. So this is Monday through Friday, 8 a.m. to 5 p.m. Central Time, and it's 1-888-4-STROKE, STROKE. You guys will get a copy of this recording to write down when Carrie sends you guys out the email later today or tomorrow. And it's a wonderful resource. I'm not quite sure what the limits are on their ability to help, but my goodness, why not try? So what we're going to do is end with our self-empowerment statement. And as always, I like the idea of you guys saying this along with me. You can say it out loud or say it in your own mind. The well-being of my caregivers is important to me. I will show my appreciation often. Again, if you ask caregivers, you know, what would they like? What they'll typically tell you is, I want the best outcome for my person, and I want to know that my efforts are being appreciated. It's really quite simple for most caregivers. So I hope you guys feel that that was a kind of a different window in on the stroke experience and a little bit more holistic as we bring in your caregivers right around you. So what we're going to do next time, this is, I know I feel like I say this all the time, but this really is, if I had to hand on a Bible, Karen, what is your favorite rule? I'm going to go on record as saying rule number 8 is my favorite rule. We'll be here next Thursday, November 5th at 4 o'clock as usual. And this is the one where we talk about post-traumatic stress, that exists on a spectrum. And really, you got to figure out, are you on that spectrum? Because it's a huge topic of importance for you getting better and this emotional journey. So I hope some of you will, hope all of you will join us again. So what we're going to do right now is go on over to the Q&A section. And if you guys are able or interested, you can give me a comment there and let me know what you thought about today's lecture. If there's any questions you might have, any thoughts you might have. All right, so good old Jerry Wald. Jerry says Barb, who's his wife, knows when she needs to take her me time. I asked her how it was when I came home from the hospital. She said, how do you think it was the worst time of her life? That's it, Jerry, that's it. But you know, if we don't ask people about their experience, man, we're missing an opportunity for connection, because when she says to you it was the worst time in her life, doesn't that increase your empathy within yourself? Like the minute I read that, I could feel tears building up in my eyes, because it just makes you think, oh my God, that person had to show such strength to be this kind of medical caregiver to you. And then here she is having her own worst life experience. And man, can you imagine being that pulled apart between your own experience and the experience of your person? I mean, it's a lot to ask of people. And I'm blown away daily by how well people rise to the occasion. Really, I mean, caregivers just, I mean, all respect to caregivers, right? I mean, these are some pretty incredible, special people. And the other thing that's so important to ask about that time in the hospital and when you came home is because you as the survivor, you might not have had the emotional wherewithal at that time to pick up on the fact that they were struggling, to notice, to care. I mean, there was so much happening for you. I mean, some people have no memory of their time in the hospital, very little memories of the rehab time. And so, I mean, if you can't focus on yourself, there's no way you have the ability to perceive your loved one's experience. But it was a very intense time for most family and loved ones. So I think it's great, no matter how long it's been since you've had the stroke, to just approach the person and just say, you know, I've listened to this lecture, and it just really got me thinking about you and what this has all been like for you. So, you know, if you feel comfortable, I'd love to have a talk about that, you know. So Jerry says too, as far as hobbies, I was a pilot. That's cool, Jerry. I didn't know that about you. So Barb said I should go to our local airport and volunteer. Oh my God, I love that. So my dentist is a pilot as well. So he asked me to go fly with him then. And Barb said, you shake and he shakes. So she also said, probably not a great idea. But Jerry, here's the thing. It doesn't even have to be, like, if you get a chance to fly, awesome. But, you know, there's also like video games that simulate flight. Going to the airport, remember we talked about that, like your network isn't just made up of flying. It's all things related to planes, airports, the way they smell, the parts in an engine, the experience of paying attention to the instruments and making sure you're being safe. There's so many tasks that we could break down that went into a previous hobby or a previous profession. And all we're really saying is whatever way you can re-engage with that hobby is going to support your cognitive stimulation, right? Now, of course, we want you to stay safe, right? I don't want you going flying with someone who shakes. But maybe, you know, even sitting in a plane, sitting in the pilot seat, like all of that is just going to make those networks light up. I mean, man, that would be such a powerful thing. I really like the idea of doing something like that. It's great. Okay, so let me try to see another question here. Okay, Joe said, is that a Steelers cup? You know it, Joe. I live with one of those Pittsburgh Steelers freaks. They're 6-0. Have you heard? They're 6-0. It's all I hear every day. 6-0. I know today's International Stroke Day. We kind of blessed everyone as we first came in. And Joe says, my hubby was a pool player, billiards, and we're still looking for a game for him with his eye gaze computer. That is so awesome, Joe. I wish that I knew someone who worked in gaming or virtual reality to try to connect different people with different VR games. But that would be awesome. You know, keep looking for that for sure. But again, you know, the YouTube idea, they've got tons of pool games on there, you know, most amazing, you know, tricks, you know, the scratch ball goes over the 8 ball, you know, I don't know much about pool, but even putting those kind of things on, they're going to get him thinking about it. His memories are going to come up, strategies are going to come up. All of that is just, it's like ripe, just there for the taking. Okay. So Jerry also said that's he flies drones now, which is awesome. Perfect, Jerry. You're basically trying to find something else that would be similar to flying an airplane. So I think that that is totally awesome. So I got a message here from Carrie about Jane and Dick have a question for me. I'll try to find that in a minute. Mr. Charles says, do you take individual clients on phone or Zoom? So that's been an interesting part of this whole COVID thing, because the way psychology licenses work is I have to have a license where my feet are planted, and you, a patient, I have to have a license in the state where your feet are planted. So I only have a license in North Carolina. So that's pretty much limited me, although the phone has been fine for that. But with COVID, they've opened up my ability to see patients. I think it's in 13 different states. So if you go onto our website, I Care for Your Brain, icfyb.com, there's a section on there about telehealth. And you can basically look and see if your state is listed on there. And since that's happened, I've probably seen, I don't know, I've probably done just a handful And it's just like a consultation. It's really too expensive, honestly, because if people want to do a full evaluation, it winds up being too expensive because we can't take insurance from other states because you have to be credentialed with them. So it winds up being like a consultation or like a therapy session. But every single person I've talked to, it's just been, I've really enjoyed it. And I think people have gotten a lot out of it. So check that part of our website out, Charles, and maybe you'll get a chance to see. Okay, so Heather, I started holding a tennis racket, awesome, and smelling tennis balls. Then I swung the racket around a few times, and one day I was swinging forehand and backhands like I used to. Haven't tried it on the court yet, Heather. That is so cool. I wonder if you could sense in yourself like an activation, like, ooh, like a little bit of like a boost within yourself because your brain was probably like, oh yes, we remember that, absolutely. Awesome. All right, Carrie's trying to tell me here where I can find Dick and Jane. I promise I'm coming. I'm coming. I'm trying. All right. Are you guys able to type it in? Because I don't think I'm going to be able to find it otherwise. I have the chat box open, Gary. Okay. Well, you guys know my email. You can send me an email and I'd be happy to answer it next time. Heather says she did. She felt her brain go like zing. Totally happy to be back in the groove. That is so cool. I love it. I love it. I love it. Okay. Oh my gosh. Look at me. I figured out where Dick and Jane are. Okay. Is there anything that can be done about statements that are incorrect in hospital or medical records? Would you recommend sending the correction back to records and asking for a correction? Do you know anything about Bridge 2 Sports? I'm proud of myself. I found your comment. Okay, this is really good question. There are a lot of mistakes in medical records. Some are of no consequence and some are significant. Sometimes other people's medical records find their way into your medical records. So again, I suggest you get your medical records and review them for any mistakes. Doctors and hospitals are different about what they will do. Most commonly, what they will do is they really won't legally delete anything that was in there by error, but what they can do is they write an addendum, which is just an additional little paragraph stating what you want the correction to be, or if they themselves agree that, oh, this was, this is someone else's record, or, per wife and, neurologist, patient was never prescribed Dilantin, they only took Lamictal or something like that. Then they'll just typically add it as an addendum. If it's something that's really serious and bothers you, I always encourage people to call the patient advocate of a hospital. Those are the people that kind of play defense for the hospital in terms of like legal action, right? And so if you feel that it's something that is potentially libelous or really bothers you, I would go straight to the patient care folks for sure. Oh, Jerry, I appreciate you so much, as well as Carrie. I know Carrie is the one who does all these beautiful slides. She's the one that does all of the scheduling for us. She is the creative director and operations and designs, and she does all the stuff on the back end that you don't get to see too much. But Jerry, we always appreciate your enthusiasm. I hope you guys will come back next Thursday. Can you believe after that we only have 2 more sessions left? What are we going to do after that? I'm already starting to wonder. I so appreciate being here with you guys. It's really a valuable part of my week. And thank you so much for your attention. Carrie will be sending you the email later today or tomorrow. So again, thank you guys so much. Go out there and thank a caregiver today. I'll talk to you guys next time. Bye-bye.